Okay, good morning everyone. Today my topic is going to be about ADHD. Now imagine that you have an assignment due tomorrow, whether it was for school or for work. You sit down and you try to finish it, but all of a sudden your brain just wanders off. You come back again to focus and try again, but it happens again and again and again until you realize that you've wasted multiple hours that could have been used to actually finish this project on time. So you would actually either do it poorly or not do it at all. Unfortunately, that's what it's like to have ADHD. Today I want to share with you what I've learned about the treatments and ADHD symptoms. First, I will talk about the diagnosis, then about its causes, then about its types, and finally about its treatments. Let's start by understanding what ADHD is. ADHD is short for Attention Deficit Hyperactivity Disorder, which according to Milchap, the author of ADHD Handbook, A Physician's Guide to ADHD, it's when the patient lacks the ability to concentrate, to pay attention, and to finish any task that they were assigned. So according to WebMed, a well-established online website that publishes medical information, diagnosis is really hard when it comes to ADHD, just because when it comes to measuring the normal levels of its problems is extremely hard. So misdiagnosis often occurs. Although it's mostly common, mostly it happens in children, however it can also happen to adults. It affects about 3 to 5% of children, most of them above the age of 7. Now, when it comes to diagnosing children, parents and teachers play a huge role in the diagnosis. Parents can notice that something is wrong with their child from as soon as he or she starts walking, and teachers start noticing that something is wrong in the classrooms, according to the way the child sits or the academic performance of the child. Now, when it happens in adults, it's a bit more challenging due to the fact that adults have multiple responsibilities. They're not just responsible for themselves. They might be mothers, they might be fathers, they have jobs to be responsible for, and they have bosses that look over their performance overall, and they want to always make sure that they're performing well and they're doing their tasks. However, it's not the case, because they can't really control how much they focus and how much they accomplish. Now, when it comes to awareness, in the Middle East, unfortunately we lack awareness, and that caught the attention of the German Neuroscience Center that is located in Dubai. They started hosting guest speakers and campaigns in order to spread awareness, because they believe that in order for a patient to get better, it should be a cooperative work between the family of the patient and the doctors that they provide. The lack of awareness could affect the patients greatly, because it may result in bullying or in not getting promoted in the workplace, and could also have an impact or make the individual be perceived as irresponsible or ineffective when it comes to his or her social activities. Now that we understand what ADHD is and how the diagnosis is done, let's move on to its major causes. Now, Dr. Konopka, the author of Understanding ADHD, believes that there are 3 major causes for ADHD. First, exposure to technology at an extremely young age. Second, head injury. And third, it can be transferred genetically. Now, when it comes to head injury, if the head injury was focused on the frontal lobe of the brain, it could lead to ADHD due to the fact that it controls the impulses and emotions of the person. So the person would be all over the place if that part of the brain was damaged. Now, genetically, if either one or both of your parents have it, there's a 30% chance that the children will develop ADHD as well at some point in time. Now, the third and final cause of ADHD is exposure to technology. Since we all live in the 21st century and we understand how exposed children are to technology, we never see a 5-year-old without an iPad in his or her hand. This exposure to technology at such a young age would contribute to preventing those children to maintain prolonged attention. So this would later on develop ADHD. Now, according to MNT.com, Medical News Today, there are 3 major types of ADHD. Let's start with the first one, predominantly inattentive type. For this type of ADHD, the person cannot maintain attention for a long time, cannot organize tasks, and cannot finish tasks that he or she were assigned to do. And for an example on that would be a story that was published on MMT by a woman called Adriana Lynch. She's an employee in a big company. Her boss once asked her to lead a meeting on a specific day of the week because he won't be able to do that. On that day, she just went and sat down with her colleagues, waiting for the boss to show up, although keep in mind that he asked her to lead the meeting that day. When the boss didn't show up, they just left. On the next day, when she was asked how the meeting went, she just replied, "You didn't show up, so we left." Her boss was shocked. He just stared at her. He even doubted himself whether he asked her or not. You can see how challenging that is and embarrassing for the patient. And the second type of ADHD would be the predominant impulsive hyperactive type. It has some similarities with type 1 of ADHD, however, it can be different because it has multiple more characteristics, such as impatience. The children get bored immediately, children that have type 2, and they can't sit still. They create distractions in classrooms, preventing learning and creating distractions for others as well. And the third and final type is the combination type. Combination type is the most common in children. It basically happens when both characteristics of both type 1 and type 2 are equally predominant in the individual. So when it comes to the diagnosis of the different types of ADHD, it's extremely difficult because the individual should have 6 of the 9 main characteristics of each type, and these characteristics should be maintained for 6 months continuously doing routine and daily activities. Now let's move to the types of treatments. There are 2 different types of treatments, counseling or medication. Counseling is basically just one-on-one counseling with your psychiatrist. The other type, which according to Frank Bezak, the author of ADHD Treatment and Sudden Death, is using medication. There are 3 types of medications. First, stimulants, non-stimulants, and antidepressants. Stimulants are the first type of medication that is used. Non-stimulants are the second type and the safest because they develop the lowest risk of addiction or abuse of the drug. And third type is antidepressants, which is prescribed for people that actually suffer from depression because ADHD is extremely challenging to have, and it may create depression as well. So in conclusion, I believe that ADHD should be studied more, awareness should be spread about ADHD more because it's the #1 most studied and diagnosed psychiatric disease that makes children go to psychiatric centers at such a young age. And what German neuroscience is doing in the Middle East is great and should be continued. And hopefully will be continued. And I hope for a better society that is more aware about ADHD so that we can be more kind to one another. Thank you. Questions?
Yes. Well, I think it was useful, but in the beginning, we talked about ADHD, but I think the symptoms you have mentioned are for the ADD, because there is difference between the ADD and ADHD. I think I have the symptoms, so I read about it. ADHD, I think it's more like a disability.
No, it's a disorder, it's a mental disorder that affects both adults and children, as I mentioned. It prevents the ability to concentrate and pay attention for a prolonged period of time. I'm sorry, I don't know what ADD is, but what I researched is mainly ADHD, and those are the symptoms for ADHD.
Because it's like 2 levels. The ADHD is a higher risk than the ADD.
Yeah, ADHD includes hyperactivity. Hyperactivity is when you can't really control your impulses, because there are 3 types of ADHD, as you remember. The first one is the inattentive, the second one is the impulsive hyperactive. So there are different types, however, they are all under ADHD.
Yes, Mohammed.
Is attention deficit hyperactivity too?
No, I don't. I'm sorry, I don't. It's hyperactivity The one that I researched is hyperactivity.
What was your question?
Attention deficit hyperactivity. I read that it's the opposite of hyperactivity, which causes you to have a vegetable life.
Yeah, when you feel lazy. When you feel lazy and you don't move. No, seriously.
Is that what you have?
No, no.
There are two things. There's ADD and there's ADHD. ADD is a milder form of ADHD. ADHD is much more intense and severe and usually requires psychiatric treatment. ADD can be treated without psychiatric treatment, so without medication, without consistent counseling. Although some ADD patients do require medication, mild medication. Usually medication that helps sort of, they're strange medicines, they're weird chemicals, because they relax the muscles, but they sharpen the focus of the brain. So you're not lethargic, but at the same time you are relaxed, but you're very focused. So yeah. And a lot of people in the Middle East, did you do any research about numbers in the Middle East? On how many people here have ADHD?
No, not. I didn't find any recent numbers for 2015, but I read a lot about what the German Neuroscience Center is actually doing here to spread awareness.
But there were no numbers about how many cases of ADHD have been diagnosed?
I didn't come across that.
You didn't come across it, okay. It's hard to get. What about research data about college students? Did that ever?
I mainly focused on children and adults. So basically adults that are outside school and children that are inside school. When it comes to the diagnosis at a very young age in school, I mentioned that when the teacher actually notices that something is wrong. And in the workplace, basically, I didn't focus on college students.
Okay. But do you think this is something that affects students more when they're in school or more when they're in college, or equally, in your opinion?
It depends. When they developed ADHD, like for example, some people developed at an extremely young age. As soon as they start walking, you can tell that something is wrong because the process of mastering the ability of walking took a lot of time. However, the average age for the actual diagnosis of ADHD is 7 years old. If it was diagnosed at 7 years old, then it will affect them more at school time because they would actually be familiar with what they're doing and what they have. But if they were diagnosed as adults, it would affect them more because they would be aware of what they're having.
So they're more socially conscious, so probably it would be a lot more difficult.
Yeah.
Usually people with ADHD are also socially awkward. There are a lot of bad things that come out of having ADHD. I mean, can you tell us a bit about that? And other than the lack of focus, and what does that do to your potential, to your performance at work or at schools?
Yeah, at work, for example, it would reduce the ability to be promoted. It would, as hard as you work, you won't get promoted as easily as others because you might be perceived as irresponsible. For example, Adriana, the story that I mentioned. And as a mother, for 5 children, for example, you would be perceived as a bad mother because you're not able to take care of them and you would need help taking care of them 24/7. So you might be perceived as not capable of taking care of your children, which would reflect on your social life.
Yes. Okay. And on the children as well, absolutely. Other questions? All right, thank you.